Good evening. You are watching Money9, TV9 Network's first multilingual platform for personal finance. So today we are talking about the increasing COVID cases. As India has recorded over 26,000 cases in a day, and this is the highest in this year in 2021. Also, for the fifth straight day, India's COVID count has been above 20,000. So we have with us Dr. Vishnu Panigrahi with us from Fortis Healthcare. We'll be talking about how we see this second wave surge in India and how prepared we are to counter this. So, sir, welcome to the show. Thank you for joining us. So, India has recorded the highest number of cases yesterday in this 2021 year. So, how do you see these cases, and how do you see how prepared are we this time for this kind of a surge?
Thank you, Khushbu, and thank you, TV9, for inviting me from Fortis Healthcare. One of the things which I like to say is that it is a concern, no doubt. Over the last couple of days, we are seeing this across Maharashtra in particular, and some other states also have had it. But at the same time, what needs to be done, I think so, is to ramp up the vaccination. There is a little bit of obviously COVID fatigue. People have how long they can continue like this. But at the same time, I think so the message has to still go out that whatever is there in the community, one must follow the three W's. Wear your mask, wash your hands, and watch your distance. I think so because COVID is here to stay for a year or two. We don't know exactly it's because this virus is teaching us every day something new. So the message that out should go from the community, and I'm very appreciative to the print media and the electronic media. They are speaking about COVID. What are things that need to be done to see that people are safe? I think so. These three W's are very important, and vaccination needs to ramp up also. Whether the surge that has happened, is it because that we have dropped our guard? That could be one of the reasons. But if you look at over the last couple of months, with economic activity again picking up, there is more of movement. People prior to that, for nearly 6 8 months, they were practically indoors. Movement was very restricted. Obviously, with the movement now picking up, and there is definitely a drop in the guard, because when you go out in the market, you don't see everyone wearing a mask, keeping our social distance. So I think these are the important things that need to be done, and the vaccination per se has picked up very well. Where if you look at, first of all, on January 16th, when the government of India rolled it out, all the healthcare workers, and then after that the frontline workers were vaccinated, and from 1st of March this month, sorry, the people above 60 and people above 45 with comorbid conditions have started being vaccinated. But this is a very small cohort of the population. If you look at it, the
So the
government
next
had a
question is
target.
on the same thing, sir. So do you think, because there are so many cases right now, should the government open the vaccination for everybody, for all the adults?
See, because the stock is there, but the time I think so has come that we need to open up. To be, I mean, if I can say that the elephant in the room is to get more and more people vaccinated, because that's the only way that you can sort of start achieving that the target of having 30 crores by August. Because at this pace, it will be very difficult to come up to that, because the more people we vaccinate, the more people are protected. So there's less possibility of spread. So opening up vaccination is on the cards. I don't know. I think so. Government is also working on it, but they're still not rolled out when they're going to do it.
Same part, there's not been a very consistent vaccination throughout. For example, on the Friday, we had already recorded over 23 lakh vaccinations. That was the record. And but on Sunday, it was only 1.4 lakh vaccination. Even on Shivratri, the response was very tepid. So, what do you think? How to fill in these gaps?
These some of the hospitals have started this 24/7 round the clock vaccination. Some of our centers in of Fortis Healthcare already started it, but it's not there everywhere. And Sunday being a Sunday, it's all so people. Not every center does vaccination on Sundays, but hopefully we need to step up. So that is one of the reasons that you saw a dip on Sunday. And Shivratri is a very important festival, especially so in North India, if I can put it. So, these things will do happen. So let's not take these aberrations as a trend. But if you look at from 1st of March till now, vaccination has picked up. Earlier, when I was looking at the daily reports of the Fortis network, more of the patients were the walk-ins, and very few were the pre-registered, because earlier we had some problems with the registration and all that. Some everyone was not tech savvy. There was initial glitches in the COVID app, which is being sorted out. But over the last week or so, I'm seeing that we are nearly 50-50 now, and of pre-registered versus walk-ins. So the trend is picking up. So just to answer your question directly, is that the two days that you mentioned, the Shivratri and Sunday, these are aberrations. But if you look at the general trend, it's picking up.
Sir, rightly said so, but do you think in states like Maharashtra right now stands on the second number of highest vaccinations after Rajasthan, but still the contribution to the active cases of Maharashtra is very high, over 40%. So do you think much more is needed in states like Maharashtra and Punjab?
I think so, because see, if you look at it, Maharashtra is probably the economic capital of India, if I can put it that way. The Delhi being the national capital, the political capital, Mumbai is the economic capital, and around that area, the lot of economic activities, as I said earlier, the economy has picked up. So people have started going back to work. You are seeing a lot of activity. If you look at the last months also, the industrial activity also has picked up, and the major industrial powerhouse is Maharashtra. So when you have that much of activity, industrial activity, economic activity going on, these things are bound to happen. So I think so. The way forward is obviously to while you follow all the three W's, but the most important thing I think so is to start vaccinating as many as possible, and so that's the
So
only
because
way
you're
forward.
always focusing on the three W's and self-restraint, so in states like Punjab, some restrictions have been imposed. Even in Amritsar, for any event that you want to participate, a negative report for COVID is now must. So do you think any nationwide lockdown or any state-wise more restrictions are bound to happen?
So I don't think so. A nationwide lockdown is feasible, and because that's the worst case scenario that can happen to us, because we've just come out of an economic downslide, if I can put it that way, and things are picking up across the country. And from healthcare, I'm noticing also the first and second quarter of was a washout practically. The third quarter, which has picked up this is the last quarter of this year, financial year, where things are picking up. I'm seeing increasing footfalls, and this is not only pertaining to Fortis Healthcare; it's across the healthcare space, public as well as private. But we have to start. As I said, I don't. The reason I keep speaking about three W's is it may be repetitive. While we continue with the increasing our economic activities, some type of self-restraint has to be there. And I think so. Even the congregations that happen for marriages, for other social functions, we need to be much more sort of restrained in that.
So last two questions right now. So in Dr. Harshvardhan, the health minister, had stated that India is now may get 6 new vaccines. Do you think the citizens could get a choice of which vaccine could they choose?
Yeah, they can choose, because see, while when the rollout has happened, it has the government has given the vaccines. It is hospital specific. So, the one hospital gets Covaxin, they continue to get Covaxin. One hospital gets Covishield, they continue to get Covishield. But with more and more manufacturers coming on board, I think so, and emergency authorization coming in force, will the consumer, if I can put it, or the citizen at large, they will have a choice. So they can choose whether they want to go for Covaxin or they want to go for Covishield. That option will be there on the table.
So the last question right now, in the initial reports, the vaccine manufacturers and the developers have said that the antibodies have been seen to last up to 3 months very strong, and for 8 to 12 months they could last. So do you think this booster dose could be necessary every year for us to be very safe?
See, as I said earlier, this naughty virus is teaching us things every day. Even if you just would be hearing Dr. Fauci, from USA, the lead clinician as far as the COVID pandemic was concerned in USA, he keeps saying this, that we do not know exactly how long this, after taking the booster dose, how long the immunity will last. 6 8 months. It could be that just like the normal flu shots that one takes before winter sets in the Western world, something like that may also happen. But it's only time will tell. We still are learning every day. But this much I can say, because when I've seen some of our doctors also have taken the second shot, the first shot, second shot, and they have tested their, out of curiosity, their antibodies. Their levels have gone up. So obviously that the first and second shots have stepped up their antibody levels. So obviously they have some immunity with them. But how long
Okay.
it will last, whether we have to take it every year, only time will tell. Uh, the presumption is that probably it may be every year you may have to take it, just like a flu shot. But just let's be patient and let's do one thing at a time. Is that let us get as many people as our population can be vaccinated. That's the first priority.
So,
Whether we
so
have to
adding
take
on
it
this
every
part
year.
only, because right now we are maintaining 20-day gap in the two doses, while some other countries are practicing a 3-month gap also, and some have recommended also a longer gap. Will that be the right choice for India also?
See, one of the reasons we, because this was put up to the ICMR also. They were looking at whether 4 weeks or want to increase it to 8 weeks, but they felt that let's stick to the 4 weeks thing, because that way we quickly get one cohort of patients, rather workers, healthcare workers and frontline workers vaccinated. Now they're looking at the second lot is the people above 60 and people above 45 with comorbid conditions, because this way they can ramp up the vaccinations and quickly go ahead. 8 week hiatus may delay the process further. That's
Okay.
that's the thinking, but we never know. So because government also is not dogmatic, in the sense that they are also looking at data, at scientific literature, and the judgmental call will be taken.
Okay, sure. So thank you so much for joining with us. And you, as you focused, it's rightly said that masks and social distancing are the right things to follow right now, and that are the only things that will take us ahead in fighting this pandemic. Thank you all for joining us. Have a good day.